Well, October is National Breast Cancer Awareness Month, and we are asking questions on the importance of getting regular screenings and also knowing your risk. And joining me now is Premier Health breast surgeon Dr. Thomas Heck. Thank you so much for joining us, Dr. Heck, on an important issue in an important month. And you know, fewer women were getting screenings due to COVID. Just what kind of impact have you seen the pandemic have on women and their health, especially when it comes to screenings and breast cancer?
John, what we found, of course, during the COVID time, the number of mammograms being performed went way down. But I checked this week, and at least within the Premier system, the numbers are back up to basically pre-COVID numbers. So fortunately, the people in our community, I think the word is out that COVID is not gone, but I mean, it's safe that they should go and have their mammograms performed, and they're doing it.
So they're getting their tests now. But what are the ramifications that you have seen of the women who did not get their regular screenings during the height of the pandemic?
Well, not just during the pandemic, but just in general, people who do not get their routine yearly mammograms, that's a very big mistake, because multiple studies have shown that with routine regular mammography, it decreases their risk of dying from breast cancer by about 20 to 25%. This was documented through a Mayo Clinic study years ago.
Risk is a big word. Family history is another big concept too when it comes to breast cancer. And a lot of women know their risk, they know their family history, but for those who do not know that family history, what's your message to them?
Through their family physician, their primary care physician, nurse practitioner, whatever, someone has to, who knows how to assess their risk, has to be involved, because you can't just say, there's nobody in my family who's never had breast cancer, so I really don't need to get that mammogram. The point is that the majority of newly diagnosed breast cancers do not have a family history of breast cancer. So women, the message is, don't use that as a reason not to get your mammogram. Then there are different ways to assess their risk. Sometimes it's a blood test to check to see if they have a genetic mutation, the BRCA gene. But even if they don't, there are other factors, there are other models that we use that can estimate what their lifetime risk is and then act upon it. All
right, Dr. Heck, let's talk about testing and treatment options. For the women who have concerns out there, how do you address that?
Well, if it's a newly diagnosed breast cancer, we spend a lot of time talking about the different options that are available to them. That can involve a very detailed discussion of lumpectomy, where you take out just where the cancer is located, to possibly mastectomy, to nipple-sparing mastectomy. So it's a very large discussion that we have to see what's appropriate for that person to obviously take care of the cancer, but to also allay her fears about a possible recurrence in the future.
All right, let's talk about going in between the ears for a second, because as physically damaging and difficult as this disease can be, the mental aspect is also a big portion of the care. What approaches are you seeing that are most effective, and what's your message to those who are struggling mentally with it as well?
And you're spot on. The mental toll can be, in select patients, can be overwhelming. The surgery and the thought of having cancer is bad enough, but they need that support system afterwards. Going through treatment afterwards, such as chemotherapy, radiation, and so on, you need a support group, because it can be very damaging, if you will, to your quality of life. But that can be so much help if you have that support system behind you. Everyone from family, friends, to breast cancer support groups that we have in our community.
You know, you hear it so often, you know, like my mama used to say, put a smile on it, right? And it's amazing what just that mental approach can do for something like this.
It is huge. Really, the quality of life, and they're going through a very dark period, is so important for them to be compliant and for them to do better. Studies have shown to handle these post-surgical treatments a lot better.
It's such an important issue and such an important month. Dr. Thomas Heck, breast surgeon with Premier Health, thank you so much for helping us in what is a very important message to get that awareness out, to make sure that you get your screenings. Yeah, get it done. Thank you, Doctor.
Thank you. My pleasure.